raised in Israel. He studied medicine in Germany, and he then trained as a thoracic surgeon in Cologne. His main focus is aortic surgery and heart-lung transplantation. So it sounds very sophisticated and complicated. Nothing I would try to attempt. And he is particularly interested in women's heart health, as he believes women are often diagnosed later and experience their health differently. And this has been confirmed now in many, many, many different studies. Beyond surgery, he's made a name for himself as an author, a speaker, and advocate for more compassion in medicine. He founded Stichting Stilgezet and wrote Als het leven stilstaat, When Life Comes to a Standstill, which is available in Dutch, English, and German. He speaks 5 languages, but I think we'll stick to English today. So thank you very much, Ehsan, for joining us. Thank you. We'll do this as a question and answer session. For those of you who are attending, please feel free, if you have any questions as we proceed, put them in the chat or raise your hand, and we'll be happy to address them. I mentioned in the introduction that you are an advocate for more compassion in medicine, which sounds like a natural thing. But where do you think the biggest challenges lie in this area?
Now, what we are very often do is following the routine. So yes, we studied, we have done a lot of things. Everybody of us is willing to help people. But we have to recognize and to understand that a patient, as example, is nothing else than a human being that left his comfort zone, very surprised, often unprepared, and there is nobody with him to take care of him. And this is actually an absolutely human thing, but this is the most challenging issue I face. Are we realizing this enough? Are we empathic enough to see those things behind the people in front of us, the patients and their family?
It's, the points you raise are interesting. I mean, you are really a highly qualified and specialized surgeon, and is often the perception that people like you, with all respect, tend to focus more on the technical aspects of the body, concentrating on immediate interventions and sometimes overlooking the emotional and long-term aspects of health. How do you personally manage to maintain a more balanced perspective?
You know, when we are trained to deal in dangerous areas. And I mean, it's the heart, it's not a leg or a finger. So this is a training that you do, how to manage immediate risks. And our success is measured by survival of the patient. So what I do is, when I go to the OR, when I prepare an operation, this is going hours by hours sometimes to prepare this in your thoughts and together with the team. But I'm not looking for who is going to create the complication X or Y and who is guilty. Since our success is measured by survival, I try to train people how to share this success. And this is a total different mindset. When you start adventuring in heart surgery, as example, or any kind of adventure, to discuss which result are we going to earn together, instead of looking who's going to pay the bill. That's how I do it.
You know, at SPX, we focus very much on patient experience and helping care organizations get the most out of it. We've experienced that, again, with all respect, that it's not always the medical experts like yourself who are the first to kind of jump on board on the topic of patient experience. What do you think would make it easier for more of your colleagues to dedicate time and effort to this important topic?
You know, a heart surgeon, as example, is the last one in the journey of a patient. The patient receives a diagnosis and runs weeks by the cardiologist or the GP. And then he comes to us, and in good cases, he will experience the surgeon one day because he will be released and discharged 4 days, 5 days after surgery. So we are really we don't have enough contact with the patient, but we are doing the most impactful something in a patient life. From this aspect, we have to go back and think, what should we do to have more contact to our patients despite the shortness of time? And that's the empathy you can give to our patients. In the polyclinic is the first moment we meet a patient. Then you have 15 to 30 minutes. Of course, the patient will not remember which technique I used, but he will remember which empathic doctor was sitting in front of me, who addressed my wife since she is in the same journey. Those things are what I'm running behind, and I want to see this growing and growing the world. Yeah, empathy.
And Ehsan, maybe following up on that question, because I understand also from the resume that we gave at the beginning of the talk that you are obviously yourself very motivated in this direction and that you care about this. If you look at your colleagues, and again, without criticizing anybody, but what do you think would be needed to get them more become more sensitive to this issue of patient experience?
You know, the feedback of the patients and their experience is our guide. So we have to listen to this. We have to adapt to the feedback of the patients. And when they tell us we are not listening, we have to learn to listen. When they tell us we are not connected with them, we have to follow up them and to connect with them. And you know, everybody who's in giving care to people in agony and people in need is doing this because he wants to help. And some of them, they don't have the tools how to approach people. Those people are my target, as an example. Then I give them the tools that we have put in a book for this. And then you know, okay, those are similar things, simple things to be implemented from tomorrow already. So when you see patients at the polyclinic, you can ask his wife, how are you doing? Are you sleeping well? This is not costing me no minute. I mean, and there are a lot of so many things that you can do that have big impacts to the patients. And I think this is what we need to change in minds of my experts. Yes, we are big guys and we save life, but patients needs more than this.
Fascinating. Ehsan, you referred to your book. You are an author, a speaker, an advocate. I mentioned in the summary at the beginning that you've also done a performance, etc. You have a special platform. Could you share a little bit of what you've been doing and why you've been doing it, and what you're hoping to achieve through all of these activities?
Yes, thank you very much to bring this subject in this interview. The reason behind my activities is, I think, coming from my upcoming. I grew up with as a son of 13 people, so I have 11 siblings. And when you grew up like this, you are attached. And yes, we have sometimes not very easy times, but all the time it was warm. And that's good, because so you learn there what is humanity. Now, being Arabic and poetic, I observed that the heart is the organ that needs to be fixed. But behind this heart, you discover the human. And this forms you, in fact. Now, my question was, what is needed to achieve this impactful change and to give people the tools, necessary tools, to get them happier in their life and satisfied after interventions. Why I'm saying this? Because we see up to 40% of top, fantastic operated people, up to 40% are unhappy and unsatisfied in their life, despite fantastic care. That's a big number. So that's driving me to understand what's happening, what to do, and where to do. And to do so, I wrote this book. I've put in those experiences and all the stuff in this book to have a kind of tools to give it to people, to learn, anticipate, learn, accept, to strength, resilience. But this is not enough. This interview is, of course, I'm appreciating this, but it's not enough. I'm talking today for nursing experience in front of thousands of people. Not enough. And therefore, I decided to use art. Since art can reach everybody in the world with the same language. And that's what we have done with the performance. So I was happy that one of the biggest stars in the Netherlands, Ellen ten Damme, which I will be speaking after minutes, she agreed to help us because she underwent such a frightening diagnosis and she has her roller coaster. And yes, we were extremely successful with this, with the shows. We had fully booked halls twice. And I think we will continue doing so because art is great in bringing empathy to people.
Excellent. Very, very original. I think a very interesting approach. Maybe one final question from my end before we open it up to the floor. Given everything that's changing, all the medical science improvements, all the technological aspects, all of the cultural changes, etc., what do you think the future is of patient experience? What do you think it will look like for patients in the future?
Now, this is, of course, a big answer, but I will choose the simplest one, which is the patient will not remind and remember which technique and which innovation has helped him. He will remember which doctor, which caregiver, which nurse, which beloved ones hold his hands and was there as he was in agony and he was in need. That's what we should continue addressing, and I think that's humanity. So whatever would change, humanity must be number one.
That's a nice it's a nice message, and I think we share that kind of belief within SPX. I will open up the floor to questions if there's anybody that wants to ask a question. Otherwise, I can always continue. Please raise your hand, or you just open up your mic and just ask the question. Always difficult to ask the first question. We have 5 people participating. Maybe, Ehsan, then while we await for the questions to arise, you have this badge of nursing on, and you mentioned that you are speaking for a platform of nursing or nurses. How do you see the interaction between different healthcare professionals in providing this patient experience? How does that work in your mind?
Yeah. First of all, we have to work as a family, as one unit, because we are in the same journey the patient is on. The patient is not alone. He's with his family and with us, face by face. We're going through this. This is how I see it. And I see, unfortunately, still differences between specialists and nurses. So many nurses today, as example, they told me, wow, fantastic, inspiring, and I want to read the book, but maybe you tell this also to your colleagues because they experience a kind of steps, and the difference between us, the big guys, and the nobody layer. So this is not the case. The patient needs us all together, and I cannot perform surgery when the floor is not clean. So everybody is absolute precious colleague in the floor. Yeah.
Yeah. I like the concept of family, which you mentioned. Maybe also an image which I've heard you use in the past is the concept of roller coaster. Could you explain that a little bit? What do you have in mind?
Yes, I created, to make this roller coaster visual, I created a diagram where we are in a comfort zone, a high level of quality of life. If you imagine a line, so we are in the quality of time to the left, high, and down is the time. And we are up in high quality of life. To be there because this is our comfort zone. Life is beautiful. But then we leave it, not because we want. At once, we have to leave the comfort zone due to frightening diagnosis or whatever, and then we crash. We crash in following the phases of grief described by Kubler-Ross, where we are in shock, then we don't want to accept it, and then we go to wild emotions, and then we start damaging our control, and this leads at the end to acceptance of your situation. Not accepting because understanding the impact, accepting because of, I can't change it, I don't know what to do.
Yes.
Then you go towards the OR, as example, in case of heart surgery. After weeks on the waiting list, unprepared, then you crash again because you go to the deep shock because maybe this is the last night you are alive. And of course, you will survive this and come back in an ascending branch towards the new life. And this is challenging because people want all the time go back. And they want to do this because they know the comfort zone and they're afraid of new unknown things. What happened in the crisis is that you change. People that enter the crisis come back when they are changed when they are out of the crisis. So if we prepare ourselves better for a crisis, we come better out. This is the work I'm doing. So according to this chart, phase by phase, I try to do inspiration, to achieve recognition, to at the end of the story, to strengthen resilience to recover towards the new idea.
Very interesting, Ehsan. I think we have a question from Axel. Axel, please feel free.
I'm picking up my son from who's doing exams and finals. This is a wonderful psychological approach that you're taking. It's absolutely great to hear this. I'm involved myself with digital health, so indeed there too one thinks less of the technology and more of the psychology. May I ask my question from the perspective of the NHS? I did a lot of work in the UK, and there the transformation seemed to push harder and harder towards getting the organization to work more like a factory. I mean, the notion of piecework or a assembly line, Charlie Chaplin, modern times, the assembly line comes to mind. Quick, 10-minute appointments, look at the screen, 5 minutes, if that's look at the patient, and then on to the next patient. That seems to be pushing in totally the different direction. What's your view on that?
100% agree with what you say. That's the reason why I left Germany 18 years ago already. I used to do 3 procedures a day, heart procedures, but I was finishing at 5 o'clock, I was home. I was one of the fastest surgeons. But at a certain moment you discover, no, this is, we are dealing with humans, not in a factory. That's why I left Germany. But, I think I will, all the time, when somebody is running behind me, ask him, 1 second, please, let me feel the feet of the patient. And there is nobody who will say no. Let me give this patient a hand. This is how I face this. And I think this is efficient, that's costing time. And with this, we give them a contra. We don't agree what you want from us. We're not in a factory. Yeah? Because if this come public, really public, we will have a severe problem with this. Because you will close your hospital if you don't have patients. They will not come to you. So I give you, I agree with what you say, and I'm totally disagree with the policy that is changing hospitality to factories.
Thank you, Ehsan. Any other questions from any of the participants? I am full of questions, but I want to make sure that you get the opportunity to ask yours. Maybe, Ehsan, within shared patient experience, we are working a lot on topics like PREMS and PROMs, so patient-reported experience measures and patient-reported outcome measures. Do you have any thoughts on our ability to? You mentioned earlier that getting patient feedback is very important. In your experience, what is the best way to really get fundamental feedback from the patient about how he or she is experiencing the whole care path?
Yeah. Patients need, as I said, they need trustful relationship with people around them. And if the more this line is stronger, the more the trust is available, the more the feedback is often and more often. Because it's not all the time when patients are repaired, they forget you sometimes. But when they will remember who you are when they trusted you, and they will give you their feedback. So work on a trustful relationship towards your patient. That's what I can say. And read the book, of course.
Yeah, maybe because I haven't mentioned the actual title of the book, which is my mistake. So maybe you can mention, feel free to make some publicity for your book, because I should have mentioned it in the introduction.
Yeah. This is, well, you mentioned it, but I will tell some more about it. This is not a book that I'm selling to have some money of this. You will never be rich of a book. But this book is a message that we have to spread, because people that read the book, they have a different look to life. As example, imagine that our kids already learn to accept that things will change in life. And when they change, they are prepared. This is one of the messages in my book, actually the opening of the book. The title of the book is When Life Comes to a Standstill. Yeah, but then, what will then happen when life comes to a standstill? And of course, this is not end of life. So in the book, I have some tools how to deal with a life that's standing still, to define your quality of life. As example, a race, some bicycle racer, when he have a roller coaster, his target should not be to race again. His target should be maybe cycling again. This is quality of life. So the quality of life will change, but will be precious after surviving a roller coaster. And yeah, those are the messages. How to deal with a new situation, confronting situation, and how to use positive energy out of the negative event. And this is a mindset. So you learn to look behind positive things. And this is something like empowering, with this action, I'm empowering patients and their beloved ones, but our caregivers also.
Well, Ehsan, thank you very much for your positive energy. It was really very interesting talking to you. Thank you also to all of the people that dialed in. As I said, registrations are open for the SPX Congress in October. We have the SPX Talks, which you can watch later on our website and our YouTube channel. And in fact, it's what most people do is watch it in a delayed mode. But again, Ehsan, thank you very much for taking time out of your busy schedule. It was very, very interesting. I enjoyed it, and I hope the other attendees did as well. I wish you a very pleasant day to all of you. Thank you.
Thank you for having me here, and I appreciate your time to interview me. Thank you very much, guys. Keep in touch.
Thank you.
Bye-bye.